Democratic Alliance is ringing alarm bells about the number of hospital beds available for Gauteng's COVID-19 patients. The country's economic hub currently has over 23,000 active cases. That number is expected to increase as holidaymakers make a return from hotspot areas. The DA's Jack Blom is calling for an urgent meeting to establish the province state of readiness expected in the surge of patients. He joins me now to discuss this further. Mr. Blom, many thanks for your time this evening. Let's perhaps start with the current state of affairs in Gauteng right now in terms of how our facilities are dealing with the second wave.
Well, at the moment, according to official figures, there's about 2,600 COVID-19 patients in both private and public hospitals. You should compare this to 7,500 patients at the previous peak, which was in July this year. So, there is some capacity at the moment. I know that private hospitals are expressing great concern. The Premier of this province, David Makura, has told us that there are an extra 2,000 beds that have been constructed at different hospitals. My concern is, are these extra beds properly staffed? Do we have the equipment and oxygen? Oxygen is incredibly important for this disease. And I really think that the Gauteng Legislative Health Committee, in which I serve as a member, needs an urgent briefing from the Gauteng Health Department about how ready we are for what's going to happen when everybody comes back from leave next week.
And as we talk about our state of readiness, as people come back to the economic hub, as you've mentioned, next week, what kind of steps should the provincial government be taking to ensure that readiness?
Well, 246 new personnel are starting at the Chris Hani Baragwanath Hospital on Friday. I think that's a very positive move. I hope that other hospitals are similarly beefed up. But having adequate staff with proper personal protective equipment, I think, is absolutely critical, because you must understand that a fair number of them, unfortunately, are going to become infected. And we need to have reserve staff, because that's going to be the major constraint. I think the beds that we have could largely suffice, provided that they are properly staffed. But this disease has taken everybody by surprise. I think that we have to be properly prepared, and I hope that when staff come back on leave, because that's the situation at the moment in many of our hospitals, is that they're short-staffed because people are on leave. So I expect a steep ascent in cases, unfortunately, in January and February. And I think that the people of this province need to know just how ready we are for this anticipated surge.
Is there a worry from your side that the provincial government might come back and say, look, we just don't have enough resources to add on to the facilities as we prepare for the surge, this stemming, of course, from previous instances of corruption and the like?
Well, yes, I am very concerned. They've spent 500 million, that's an enormous amount of money, on the Anglo-Gold Ashanti Mine Hospital, which was given to them by the company in the West Rand, which is not a highly populated area. And in fact, there was supposed to be 176 beds. Only 56 of those beds have been completed, and there's no staff or equipment. So that's a complete waste of money. R500 million on a hospital far away from the major urban centres. I'm also concerned that, there's 300 beds that were built at the Jubilee Hospital, also in the far north of Gauteng. Are we going to be using them? Do we have staff for that part of Gauteng? It really would have been better if the more central hospitals were beefed up properly, because I think it's more likely that you'd get the staff to run them there. So that's exactly why I'm hoping that the Gauteng Health Department briefs the Legislative Health Committee as soon as possible, because these questions need to be answered.
One thing that we'd also like to know about as soon as possible is the vaccine, the reasons it's only coming in the second quarter, and how critical it will be for government to pour all its resources into ensuring that it comes in as soon as possible.
Absolutely. I mean, I was devastated when the president said that it's going to come in the second quarter, when previously they've said it's in the first quarter. And we've seen many developing world countries who already started to vaccinate their population. Of course, the priority should be our health workers and elderly people and people that are especially vulnerable to this pandemic. So I really think government needs to tell us what they're doing. They should be pulling out all the stops. There are a number of successful vaccinations, at least 4 at the moment. We should be dealing directly with the companies concerned. There's quite a large medical aid population, so if the companies negotiated on their behalf, it wouldn't cost the government a penny, and we could vaccinate at least 20% of the population that way. But obviously, we'd like to see a mass rollout, and starting with the most vulnerable people, particularly our health workers.
And then a final thought from you, Mr. Bloem. It's going to be unsustainable for us to shut the country down every time there's a surge. Are you having conversations with stakeholders within government about ways in which we can handle it better? Because we'll keep losing jobs and the economy will continue to find itself where it is currently.
Well, absolutely. It's always been trying to find the right balance between lives and livelihoods. People die from joblessness, from hunger, from other illnesses that are not treated at this time. So I think we need to strike the appropriate balance. But really, I would like to appeal to everybody. It does boil down to personal behavior. I think people should act responsibly. Don't drink and drive, because we certainly don't want our casualty departments full of drunk driving incidents, and please, I think, stay out of what they call the super spreader events. Those are largely indoor events. It's much safer outside, and people should adhere to using masks, social distance, washing their hands regularly. I think it's incumbent on all of us to do what we can to make sure that this epidemic doesn't completely overwhelm our hospitals.
Jack, many thanks for your time this evening. That's the DA's Jack Bloem giving us an insight of the state of affairs in Gauteng when it comes to COVID-19.